Hi, Dr. Sean here from Alaska Healing Arts Chiropractic and Rehab, and today we're going to go over a couple in-office treatments that we would utilize for an acute ankle sprain. These two treatments are going to be myofascial cupping and taping to help reduce the inflammation in that swollen ankle and help to push some of that inflammation out of the inflamed area so that we can get some new blood flow into there. So we're going to go ahead and grab our patient and we're going to go through those two treatments. Alrighty, so here we're going to go through the myofascial cupping for an acute ankle sprain. So in this situation, we'd be dealing with a lateral ankle sprain. So we'd have a decent amount of edema and maybe some swelling or bruising on the outside of the ankle. So we're actually not going to be putting the cups there. We're actually going to move them up into the calf to help draw out some of that inflammation. So in the office, we use two different sizes of rock pods and some of the rock rub. So what we're going to do is we're going to first start just above the ankle in the lower calf, and we're going to put a couple cups there, one on either side. One on the inside here, outside, good, and then one just on the other side of that. We're going to put one above that on either side. Good. And in this scenario, since we're dealing with an acute injury, I'm going to first start by taking through some gentle, nice passive range of motion to just help some motion in that ankle. That way the muscles are not having to control it, and I'm going to do everything I can possible to keep the patient nice and relaxed. This should be in some pain-free range of motion, so we're not drastically increasing the inflammatory response, but we're also gaining some nice range of motion. If we get to a point where that's been beneficial and it's appropriate, we can start to have the patient go through some active range of motion, so they can start to help out a little bit more, get a little bit more of an effect in the cups through those muscles, and really start to get the inflammatory process out of that ankle. Alrighty, so that's how we're going to go through myofascial cupping for an acute ankle sprain. So this is a taping procedure that we might utilize in the clinic for an acute ankle injury. This is called a basket weave taping. This is going to be utilized to help draw out the inflammation in that area where there's the swelling and edema. Day one, if you're coming into us with an ankle injury and you have a decent amount of swelling, this is something that you are going to be walking out with more than likely. Obviously, every injury is different, so it could change, but this is a very common taping procedure for an acute ankle injury. If you have any questions about ankle injuries or acute ankle pain or anything like that, feel free to reach out to the clinic, message us on social, or go ahead and stop by.